Alright, in our last video we talked about the role of the different glands of the anterior pituitary, and then we went through some of the glands that are throughout the endocrine system in charge of hormone production. So looking at the pancreas, we said the three hormones of the pancreas were insulin, glucagon, and somatostatin. Again, somatostatin I'm not going to hold you accountable for. We're going to mostly focus on blood sugar control with the pancreas, and that's insulin and glucagon. So insulin does not need the pituitary gland to tell it to secrete it, to tell it to be secreted. The pancreas secretes insulin when glucose levels are high after eating a meal. So when we eat a snack or a meal, that sugar is digested in our digestive tract, broken down into glucose, and absorbed into the blood. So the bloodstream has high levels of glucose, which stimulate the pancreas to secrete insulin. So when insulin is secreted, there's receptors for insulin on all of our cells, particularly liver cells, muscle cells, and adipose cells, but all cells will use glucose and have receptors for insulin to help them pretty much like open the door and let glucose into the cells to be used for energy. So as glucose enters cells to be used for energy, then the blood levels go down. So the goal of insulin is to lower blood glucose and allow that glucose to enter the cells. So here we can see we have a high blood glucose after a meal. The response by the body via a negative feedback system is to secrete insulin to the blood, and the liver takes up the insulin, uses it to store that excess glucose as glycogen. The muscles use it for energy and again store it as glycogen, build more muscle, and adipose cells use the glucose to store the energy as fat. So as a result of the glucose entering all of these cells and other cells of the body as well, the blood glucose lowers. So that's an example of a negative feedback system. We have high blood glucose, the body kicks in, and that lowers blood glucose. So every time we're looking at negative feedback, we always see a reversal of the original stimulus, which in this case was high blood sugar. So that's the job of insulin. Now glucagon is different. It's the opposite of insulin. It's secreted when blood glucose levels are low. So if you've ever gotten up in the morning and went to class and didn't eat breakfast, you don't struggle with the low blood sugar because of good glucagon secretion. So when blood sugars are low, the pancreas secretes glucagon, and that stimulates the liver to break down stored glucose, which is called glycogen, and it releases that glucose to the blood. It also breaks down fat and protein and releases sugar or glucose into the blood. So glucagon will raise blood sugar by breaking down stored glucose in the liver, muscle, and fat. So again, it's the same thing. It's a negative feedback system acting in the other direction, opposite to insulin, where we have a low blood sugar, and at the end we end up with a higher blood sugar. So diabetes is when we have excess, diabetes mellitus specifically, is when we have excess sugar in the blood because there is not, the glucose is not entering cells. So diabetes type 1 and type 2 have different causes, and the physiology behind that is a little different, but regardless if it's type 2 or type 1, it's going to result in high blood sugar. So there's a problem with the uptake of glucose into cells in both type 1 and type 2. And the issue with having high blood sugar is high sugar levels damage the most fragile capillaries and nerve endings. So the most fragile nerve endings and capillaries are found in the feet and in the eyes. So because high blood sugar is damaging to capillaries, the retina, which is in the back of the eye and necessary for vision, can be damaged by uncontrolled diabetes or chronically high blood sugars. And also the capillaries of the feet and legs, lower legs, are also damaged. So if a person, and the neurons and the nerve endings are also damaged, so a person has numbness in their feet and they step on something sharp, they may not feel it, and they might have a cut on the bottom of their foot. And because of the poor blood supply due to damaged capillaries, there is less healing to that area, and people have come in with, full bloodborne infections, all as a result of stepping on, something sharp on their carpet. So that numbness can really be dangerous for people. So we always recommend that people with diabetes wear shoes at all times in the house as well to protect the bottoms of their feet. And if you know somebody that has, uncontrolled diabetes and has numbness and tingling in their feet, encourage them to take good care of their feet, because if they don't, it can result in unhealing sores and eventually amputation. And as a nurse, I can't tell you how many patients I take care of on a regular basis that are diabetics who did not control their blood sugar, and as a result had an unhealing sore on their foot or leg, and they ended up losing the leg or the toes. So it's a very common issue among people that don't control their blood sugar. Now, if a person has diabetes and they control their blood sugar, they test their blood sugar, they make sure that they give themselves enough insulin to cover the carbohydrates that are in their meals, then they can live a very long, healthy life. So it's not something that can't be prevented. It's those that don't control their blood sugar that end up with all of the complications of diabetes. And high blood sugars is also very hard on the heart, also contributes to blood clots. So heart attack and stroke is another issue. The fragile capillaries, the glomerulus of the kidneys, those are also damaged by high blood sugar. So most of the patients we see in the hospital with kidney disease that are on dialysis had uncontrolled diabetes as well. So really, really important to control that blood sugar. So type 1 versus type 2, this is part of your discussion board this week, so I'm not going to go a lot into the details on that as far as lifestyle with these conditions. But type 1 is usually a disease that sets in early childhood or adulthood, early adulthood like college age or younger. And then type 2 is usually adult onset, and it's more common among people that are obese. So lifelong obesity is a high risk factor for type 2 diabetes. And in type 1, the pancreas is not functioning. It does not produce enough insulin. So as a result, those people are going to need to have artificial insulin injections in order to lower their blood sugars. So it's an autoimmune disease, and we don't know what destroys the beta cells of the pancreas that produce insulin, but something in the environment, could be a virus. It does have a genetic component, so if it runs in the family, person's more likely to develop diabetes. But as a result of no blood sugar in the entering cells, the cells essentially starve and start to attack protein and fat for energy because there is no glucose without insulin. And as a result, those individuals lose weight rapidly. They're excessively thirsty. Excuse me, sorry about that. They're excessively thirsty and urinating a lot because of the high blood sugars causes that excess sugar to enter the urine. So sugar in the urine is always an abnormal finding and can often indicate diabetes. So they need to take insulin daily, and that's kind of a tricky thing because insulin lowers blood sugar, and if they take too much insulin, they can end up with hypoglycemia and too low of blood glucose, and that could cause dizziness and sleepiness, and person can pass out and enter a diabetic coma. So it's very serious that we control blood sugar, and the same can happen with high blood sugars. That's where diabetic comas are most common, is with a high blood sugar that's uncontrolled. So that's hyperglycemia. So it's trying to get that right balance of insulin and sugar, in the form of good healthy foods like whole grains and fruits and vegetables, and not eating a lot of candy and soda and some things that are very high in sugar and require a lot of insulin to push that sugar into cells. So type 2 diabetes, like I said, is most common among those that are overweight or obese. So there's something with adipose tissue that causes the insulin receptors on cells not to function properly. So therefore they can't take the insulin, or they can't take the glucose into cells. So the pancreas is normal in a type 2 diabetic, but it's something about those receptors for insulin that are not functioning, so the cells become resistant to insulin, and therefore glucose can't enter cells and high blood sugar results. So there are different ethnic groups that are more at risk for type 2 diabetes, and we see that it's more common in those of African descent. And Native Americans also have a little higher risk factor for type 2 diabetes, so it's something that, like I said, can also have a genetic component, but a lot of it is lifestyle. So losing weight can make a big difference, and it's even reversible in some people. They can cure their type 2 diabetes. Type 1 diabetes, because the pancreas is permanently damaged, that can't be cured or reversed. So people that have type 1 are going to be dependent on insulin the rest of their lives. And if they control their blood sugar well, they can live long, healthy, active lives. So again, type 2 diabetes, we have cells that are resistant to insulin. So we have normal insulin production, but just resistant cells that are not taking up the glucose without having, that receptor for insulin functioning properly. So a lot of people can have type 2 diabetes and not know it. That's why it's important for people to have a regular checkup, get their blood sugar tested, and if they're told they have high blood sugar or pre-diabetes, very, very important to take that seriously and get some of those lifestyle factors under control.